Hello, we want to look at the uterus and fibroids today. I'm Dr. Aidoo with the Department of Anatomy and Cell Biology, University of Cape Coast. We have 3 specimens here in perspex jars filled with formalin. So we have a normal uterus here, a normal uterus there, and then an abnormal one. The uterus is basically the structure in the female reproductive system that helps harbor the conceptus to term. So it is well endowed with a lot of muscle cells, smooth muscle cells, that helps to withstand the growth and contain the developing embryo. Within it is the uterine cavity is quite closed at this point. And then from within outwards, it is made up of the endometrium, myometrium, and then perimetrium. Then that is the fundus of the uterus. When you look down here, that will be the internal os and then external os. So that is the cervix, and then the cervical canal will be situated there. Inferior to the external os will be the vagina with the vaginal canal. When you look at this uterus, it has been cut open on one side, showing you the interior aspect. So again, you have the endometrium, myometrium, and perimetrium. There's a developing fetus there. That is a portion of the fallopian tubes. Now let's concentrate on this one, which is our focus for today. We are looking at fibroids. Fibroids are non-cancerous or benign growths that develop in the uterus. They are made up of muscles and connective tissues. They can be as small as a grain or as big as an avocado pear or even a small watermelon. So all these globular structures you find are fibroids. And they are also called uterine fibromas or leiomyomas. Most people with fibroids don't exhibit any symptoms and usually don't even visit the hospital or seek medical attention. However, if they present with some discomfort, then you have to seek medical attention as fast and soon as possible, because there are medical treatments available. A doctor can palpate the abdomen or pelvic region, or perform a pelvic examination, or use ultrasound to confirm the presence or absence of fibroids. The common symptoms of having fibroids are heavy or painful periods, pain during sex, lower abdominal fullness, and then sometimes the urge to urinate frequently. The risk factors are age, family history, obesity, and then bad eating habits. The complications could be repeated pregnancy losses, infertility, among others. The treatment available can be medication or surgery. So you may have myomectomy, endometrial ablation, or uterine fibroid embolization. There are different types of fibroids. You may have one that develops from the submucosa outwards, so we call that the submucosa fibroids. You have one that can develop within the myometrium in those smooth muscle cells, and we call that the intramural fibroids. You may also have one that develops in the serosa of the uterus, so we call that subserosa fibroids. And then you can also have one that will bud out just like a fruit that develops from flowers and hangs on a tree. We call that the pedunculated fibroids. So in this specimen, most of the fibroid you see there are submucosa fibroids and then intramural fibroids. Some also are protruding outward like a pedunculated type, but it is not hanging like a fruit, so it's likely to be one of the intramural ones that is permeating outward, or a pedunculated type, which is just masked by some tissues. That is the fallopian tube there, and then the other side is also the fallopian tube. So this is the information I want to put across today. Thank you very much, and I hope this video helps impart some knowledge.
Please like and subscribe.